Good afternoon, everybody. I would like to welcome all of you to our practical workshop on transcutaneous CO2 monitoring with a specific focus of mechanical ventilation. And honestly speaking, I'm really happy that we can do this symposium now for the second time. Transcutaneous CO2 monitoring has the clear advantage as it is perfectly valid for chronic respiratory failure. It is also perfectly fitting with the application of non-invasive ventilation, so non-invasive measurements, non-invasive ventilation. It's also true for screening of nocturnal alveolar hyperventilation or looking for sedation procedures like during bronchoscopy or other endoscopic procedures, and those patients being at risk for hyperventilation. So this is just an impression, just an example how important continuous monitoring is. And in this scenario, you probably agree that we would definitely have missed to detect severe hyperventilation despite the application of non-invasive ventilation.
Good morning. First of all, I would like to thank SenTec for inviting me and giving me the opportunity to be here talking about the role of transcutaneous CO2 monitoring in patients with acute respiratory failure. We can use transcutaneous CO2 monitoring in patients in the earliest stage of the acute respiratory failure, in patients we do not intubated order, in patients when we are looking for more comfort the patient rather than a stricter control of the PCO2, more severe forms of acute respiratory failure, or patients who have going to be treated in most specific units like intermediate care, respiratory care units, high dependency units, intensive care units, or something like that, probably is a clear indication to monitor the patients with transcutaneous CO2.
Sorin, I think you can stop hyperventilating. We already can see on the monitor there was a really nice drop of the CO2 and it still continues.
From a clinical point of view, this is a very important issue because the clinical condition of the acute patient can change fast in the time. So to have a device that is able to inform us in a brief period of time the clinical condition of the patient has changing, allow us to take a decision to solution the problem that the patient have.
Of course, it is the reaction time is suggested to me much more important for the acute state than for the chronic state. However, if you consider, for example, different sleep stages or mask problems overnight, so the more reactive the system is, the more clear would be the picture in the end.
Thank you for your participation.